Gonna do this over here, nice and easy. Whoa. I think you're 6'3" now. Let's do some more. Hi, John here. Today we're talking with Marla. So Marla, have you been in the clinic not quite a year yet?
No, it's probably been about 4 months.
Four months, 5 months?
Yep.
So tell me what you first started, you had back pain.
Yep.
So let's talk about that.
I just had general kind of joint pain. I had hip pain. I was tired. I wasn't sleeping well, and I couldn't keep on the way I was. So someone recommended chiro, and this was close to where we moved to. So this is where I chose to come.
Okay. On top of that, we also added, you had interest in the nutrition stuff we were doing.
Correct.
Nutrition response testing we do here.
Correct.
So combined with chiropractic and nutrition, what's happened to your body?
I have much less joint pain. I'm sleeping better. I think I'm handling stress better.
Wait a minute, didn't we add brain tap?
We
We added the brain tap to you
Yes.
because of the stress stuff.
Right.
And how's that? So we're doing everything. You got brain tap, nutrition, and chiro, and now your body's like, woo, let's play.
Yep. No, it's been really great. I just have more energy. I'm probably more pleasant to be around.
You're always nice.
My husband hasn't complained about that.
Well, smart man never complains about anything around his.
We moved into a condo from a house into our condo, so there's a lot of moving around and boxes and things like that. And I think that's where I started to realize I needed help because my legs, my knees were aching, my hips were aching, and now I'm up and down the steps without pain. So it's amazing.
And that's a quality of life improvement.
It is.
And that's what we're after.
For sure.
All right.
For sure.
So what's going to happen is we're just going to do a general evaluation from the chiropractic. You just keep fine tuning your body.
Okay.
And we're going to go from there. And I'll have you in just a second. We'll switch over. Other than that, is there any questions?
Actually, what's with a kilt?
A lot of people ask you that. So I like kilts. A large part of the family, actually, I have several family lines that come from Ireland and actually Scotland as well. This, however, is not a family kilt. It's a different patterns. And in future videos, I'll be wearing different patterns. But that's what the kilt is.
Interesting.
It actually is family lines.
Okay.
And I'll just give a tidbit that some of the family lines hit the colonies in 1730s and descendants that are all the way from Scotland all the way back. So it's a long line. So we'll go from there.
Okay.
All right, let's see what we got here. Always start with the basics. You know, we're going to check our arm strength here. Oh, hang on here. Let that rest for a second. I just felt that shoulder a little tighter. Hold tight right there. Don't let me push the arm down. A little weak on that one. Let's check here. Hold tight for me. A little weak on that one. Let's check the tricep muscles today here. Kind of play with different cord levels. I'm going to stabilize here. Your job is to push up. So go ahead and push as hard as you can up. Hold tight. No, weak there too. Let's come up over here. Push as hard as you can up. Really hard. That's a little squishy too. Alright, let's check some grip strength here. So on this side, I'm going to have you roll the fingers in, squeeze really tight. Okay, that's wrong. Look down towards the floor so we kind of see where it stops at. Hold tight. So further down, she's really strong. So about the middle of the neck is our main problem. Let's check this one here. Hold really tight for me. That's really good too. I like that. All right, let's jump down to the feet. So let's bring this leg up for me here. Hold tight. You're squishy again. Hold tight.
I guess I'll be coming for a while, won't I?
You gotta take care of that body. But you know you're doing that with nutrition and
Right.
walking and just exercising.
Right.
Nobody's perfect, but we can certainly be mindful of how we take care of ourselves. Hold tight. But this one's actually not bad here. Hold tight. It's not quite 5 out of 5. As we know, muscles are graded from 1 to 5s. 1 and 2s are never here in the clinic because they're paralyzed in rehab. 3, 4s, and 5s are what we work on. 5's really strong. So those are about a 4. They had power to them,
Okay.
but I could overpower them.
Okay.
But you know, obviously this muscle here, the deltoid is about a 3, where bring your arm all the way up, extend it all the way, hold tight. I don't even have to try, I can just get it right down. That's a 3. So those are things we gotta work on. How's the muscle tension in the shoulders? Feeling good?
Yeah, it feels good.
No headaches, nothing
No.
like that. Let's go face down. I always like to do extra muscle work though, just to relax the body a little bit. Slide down a little bit from here. Drop this down here. Are you comfortable?
Yep.
Good. Let's assess the strength here. Lock this knee and bring the leg up. All the way off the table. Hold it right there for me. Do not let me push it down. That's pretty weak. Let's bring this one up. Hold tight for me. Oh, we got something going on here we're going to work on. All right. So on a scale of 1 to 10, and 10 is the worst you've ever felt, like when you first came here, and 0 is pain-free, where do you put yourself today?
2.
2. Really not bad. This is more of a fine-tuning of her body. But Marla, she's been taking care of herself now consistently for a while. A lot of pain when she started. And this is more follow-up visits and just fine-tuning as she continues to improve her quality of life for herself. And of course, you hear from the beginning all the good gains that she's made with chiropractic care, nutrition, and everything else. The goal in my clinic is, can I get everybody to 100 pain-free, drug-free, and disability-free? Don't know if we're going to make it, but we're going to try. Is this okay for you?
Yeah.
Good. I like doing this percussor, and I just like to gently go up the spine on a few. Just helps relax those joints in there so we can get a good adjustment here. There we go. I'm not feeling a lot of tension. It feels really smooth and relaxed on me. And this is what we typically see as the body is being worked on. Consistently, it starts to change and the muscles become more relaxed, the posture gets better control. I am going to fix 2 problems over here though. So let's just kind of clear this one out real quick. Well, there we go. No, now it's gonna. Edit, stop. There it goes.
How embarrassing.
What's the matter with my table? There we go. Walk the knee and bring it up. Hold tight for me. That's a little better. Bring this one up. Hold tight for me. Those are stronger, yeah? I like that. All right, let's bring the leg up and out. Hold it right there for me. I'm going to push down. Hold tight. Don't let me push down. That's really weak. We're going to fix that. Going to fine tune the pelvis a little bit more. Let's come down just a little bit right there. Here we go. I'm going to block here. I'm going to block here. Bring it up and out. Hold tight for me. Don't let me do it again. Hold tight. Let's see if we can get a little better position in that. The key here is just finding the position that creates a lock that the pelvis wants to be adjusted under. Hold tight for me, as long as you can. Not good enough. I'm going to switch up here. And that should be it right there. Hold tight. And there's the lock. Subtle, but we got it. There we go. Alright, bring the leg up, hold tight. Bring this one up here, hold tight. Yeah, that's better. Now we're going to clear here. I like to do about T7, 8, 9. This area is a big load bearing. So I just like to clear them a little bit. Take a little breath for me there. Let it all the way out. Oh yeah. You moved really well on that one. That's right. Good. Now, I'm going to check one other spot. I'd like to check this one here. Take a little breath here. Let it all the way out. Got it. Nice. Feel okay there?
Yeah.
Good. All right, we're going to switch over under our back now and flip over for me. And go flat. I think the first few times when you hear it was hard for you to roll over.
It was.
Now you're just like, let's do it. Perfect. Now let's just see what your body's going to do here. There we go. We're going to clear these neck out. Take a little breath for me. Let it all the way out. Oh yeah. Now we'll do this over here, nice and easy. Whoa. I think you're 6'3" now. Whew. Let's do some more. You always do well. Bend the knee in. Just, I know these are weak. We kind of already checked these laying down. Yeah, let's check this muscle real quick. Bring the foot in. The whole leg. Rotate it in this way. Relax. Turn your hip in.
Okay.
Hold that right there for me. This is sartorius muscle. Hold tight for me. Pretty weak.
My knees are weak.
Yeah. We've never taped the knees before though, have we?
No. I know I have a cartilage, a slight torn cartilage in that knee, so.
You know what you just told me, right? Do we have to do more work? We better check our time schedule. How are we doing on time here? You can never tell a doctor that you got other problems because we have to go to work.
You asked, so.
All right, let me bring this arm up. We're gonna do some muscle testing. Of course, there's different ways you can check. I already kind of know what cord levels are active, but I also like to kind of just see what the body wants us to work on. So we're gonna do L2, L3, float this down. Have my assistant come over and hold for me. We're gonna do L2, L3 at the same time. Let's just see how our body talks. Let me have this leg. Let that relax. Take a deep breath in, Marla. Here we go. Exhale.
Oh yeah, that moved really well.
Good. Let's do some more muscle testing. Hold tight. Strong, strong. So that's one test. Is it enough to fix it or do I have to do more? So hold tight for me. I'm going to push here. That's stronger.
That's good.
Let's rotate in. Hold that position. Still a little weak on that one. I'm not satisfied. I don't think we're done yet. Let's go back. Is that your belly button right up there? I'm going to palpate in. Any tenderness in there? How about on this side? It's not point tender, but it's still a little weak. Let me see this out here. That's where it is, right there. We're going to grab that one. Let's see if I can do a little bit deeper pressure on that. Deep breath in, change the angle, put it all the way out.
Yeah, that moved.
Let's get some feedback from that muscle. Hold that position.
Yep.
That's better.
Better.
Yeah. Let's check this side. Hold tight. That's strong now. Hold tight. Push up. Better. All right. Now let's check the hips. Laying down. I like to just put a shear force into the hip, do a little muscle test. See if it's strong. As many doctors there are, dozens of different ways of doing this. Hold tight. Boy, you're staying strong. Come on up for me. Let's have you just walk around for a second. Out there, I just want to stress the body a little bit and see what it does. Are you ready to go jogging? No.
I don't think my knees would handle that.
You know, I really want to spend some time. Tell me about, when you walk, do you feel knee pain?
No.
Okay.
If anything, I'll feel hip pain sometime when I walk, but not really knee pain.
Do you have pain when do you need gardening or anything in the summertime?
Yes.
Do you have knee pain, bending down, doing stuff?
Yes.
Activity-wise?
What? Like if I to reach down like this to get something.
Does that cause pain right now?
Yes. Not at the moment, but like if I'm reaching down, like into getting into a cupboard, then my knees will bother me.
So that's just about every day?
Yes. Okay.
At
the moment, no.
At the moment, it doesn't hurt right now.
You just did the adjustment.
Right. So let's see something. So this is kind of hard for your. If you stand right here in front and feet shoulder width apart,
okay,
and with some I'm not gonna let you fall here. Arms out in front of you. I just want you to squat down. Can you squat down and come back up? And do you create any pain when you do that? Yeah. A little bit.
Yeah, a little bit.
Where did you feel it? I'm just gonna help you. Right. Okay. Both sides, both knees.
Especially this
one. We're gonna work on the knees. I know we've got the chiropractic is really strong. We'll fine tune that a little bit more in just a minute, but I want to get these knees worked on. So I'm gonna have you lay down. We put you in some shorts. Most of your knee pain, I'm going to bring a leg up here. Most of your knee pain is here, lateral, medial, lateral. Where do you feel it?
On the sides.
On the sides?
Yes.
And both sides when you do stuff?
Mostly the left side.
Mostly the left side.
Yeah.
And this one here has knee pain as well.
Mostly the right side.
Mostly on the outer. So both pains on the outer side.
Yep.
Okay. So I'm going to do a little bit of muscle work here on both knees, and we'll clean. So I like to do. How's that feeling there?
Good.
You got some bruising here too.
Yeah, well, I don't remember where that's from, but I bruise really easy, so.
We will have to take a look at that nutritionally and see if we can figure out if there's anything we can do to help you there. But here, what I'm doing is I'm just smoothing out some of the muscles. How's that feel?
Hurts.
That hurts right up in here.
Yeah.
Okay, so we probably have. I'm not going to go too hard on you. I don't want to break too many. As older we get, our skin's a little frail, and then you can get a lot of red in there. And I don't want to really inflame too much. I'm going to break up this bruise here a little bit too. You can sometimes rub bruises a little bit, feather them a little bit, and break up the blood stuff in there. It's not going to change right now, but let's go up in the muscle here. How's that feel?
That feels good.
Feels good? Like relaxing good, or you can feel
Relaxing
tightness and it feels like you're going to get it out of there?
Yes.
All right. Knees respond very nicely to soft tissue work and taping, kinesio taping. I've taken care of a lot of knee problems. No surgeries on these knees though. I don't have any scars.
No.
Let's do this one here. How's this feel? You're okay through this area?
No pain there.
Okay, good. When you do have pain though, it's kind of focused along here.
Yep.
More up here?
Right there.
Okay, let's work on that. Maybe some muscles associated with the knee as well are inflamed. Good. Drop that one down. We'll clean it off in a minute. Let's go ahead and get a little more. And then we'll get these knees taped for you. Now, how does this one feel up in here?
That is right there is where it hurts.
Right there?
Yeah, to the side.
Okay.
Yep, right there.
Got it. How's that feel? Like owie, huh?
Yeah.
Like
ow.
Like if you don't stop, I'm going to hurt you in a minute. It's okay. I'm used to being threatened by all my patients. They're usually throwing things at me. But you know what's strange is they keep coming back for more. But you know, we get results. That's what we're about.
Yep.
Just showing people there's other alternatives than drug therapy, you know. I mean, I'm not opposed to drug therapy if it's needed, but at the same time, we still have to take care of our bodies as healthily as we can. Good diet, lots of water, lots of walking, good sleep patterns.
Yep.
Keep the stress at a minimum.
I am sleeping much better. It used to be I'd wake up with hip pain and knee pain like every hour, and I'm sleeping.
So that's a good win for you.
Night.
Nice.
It's a big win.
Yeah. And that's with the nutrition, brain tap, and everything.
Right.
So that's helping you a bunch. How's that feeling there now?
That's sore.
Sore. Less, more? I mean, I'm kind of irritating it a little bit, trying to break the muscle stuff up here.
Yeah, that hurts.
Yeah. We're not going to keep making it hurt. We'll move on to something else. It's just nice to just kind of break up some of the muscles in there, get the fibers flowing, then we'll tape. Then what we're going to do when we get everything taped, I just kind of want to see if you notice a change. Some people will get some patients have reported to me an instant change. I tape them, they're like, oh my gosh, I can do squats, and it doesn't hurt as bad. Sometimes it's a couple days later, they're like, oh, I noticed less pain, they report back, you know. We never know what you're going to get. We just try to do the best we can and create really good changes for folks. So I'm going to clean your knees off. We always clean after we're doing, because the tape will, we got the skin clean because tape doesn't stick to the cream that we use. So now what we're going to do is I'll tape the knee here, and then we're going to see how it feels to squat down when we're done. You see, some people get a relief instantly. Some folks, it takes a few days for it to kick in. We're going to see. Important thing is we just try to make changes in a healthy way for you. That'll work. And once again, we try to minimize too much tape stretch as we tape we stretch the skin, not the tape. Now, if we got a good tape, we should get a nice lift on the tissue there, and it does. But I'm gonna put another one here, underneath that one. And we'll try different tapings as we go along for you too. Right now I just want to kind of do kind of a basic one, see if you notice anything. Or do I have to tape different muscle groups that tie to me as well? We can tape up here, down the side. We will figure it out for you. So drop this knee down. Now let's do this one, bring it up. Okay. This knee looks a little more swollen sometimes.
Yeah, it is.
So we'll keep an eye on that too. Let me know, sometimes when you tape, you are able to decrease that swelling just a little bit. So we'll experiment with this pattern and see what we want to do. I don't like that one. I'm going to come up a little bit more, pick it up a little. This is a dead piece. Ugh. Start all over again. Thank God for modern technology, right? We can edit on the fly. So we're going to retape that one. I'm going to go a little bit above this one here and swing it down that way. There we go. I like that one. Come up a little bit there. So when I see you later in the week, we'll see how you're doing and see what we have to change a little bit. Now let me make sure I got that on there good. And then I'm gonna have you stand up. Just a second here. Go ahead and stand now. I'll have you. It's not exactly the prettiest thing to see. Do back just a little bit. You get those feet shoulder width apart a little bit. Arms out. Go ahead and squat down for me. And then come back up. Try again. What are you feeling?
I think it feels more stable.
Good. Okay. So when we're done here, we'll talk about some exercises that we can do for that.
Okay.
Just to
strengthen.
strengthen and reinforce what's normal for the knee and see if we can get some more improvement out of there for you.
Okay.
Have a seat for me here real quick. I'm going to go back up and I want to fine tune and make sure that we're completely done with the neck and everything else here. So bring the arm up. You kind of moved around a little bit. Hold tight for me. Still holding. Look at that. I'll take that option any day. Nice. The triceps was a little weak today too, wasn't it?
Yep.
Bring that up there. Push for me. Push as hard as you can up. Push this way. Yeah, that's holding. Push as hard as you can there. Look at you. You're all strong right now. But this is what we should see though. We should see the body rapidly change. Before it takes a lot of extra care to get things to hold, and now the corrections start to come pretty quick, which is what we want to see. Since you're sitting, I'm just going to check this muscle group here. Push up, hold tight. Not bad. Hold tight.
I felt that here.
Don't like that one. Bring this up again. On your back for me. Just when you thought you were done, you gave me a surprise. That's okay though, that's what we're here for. This is why we can fine tune things. There it is right there. Strong here, weak there. Which ties to the, so I'm going to push right here. I want to see something. We're pushing it pretty deep. Hold tight for me. There we go. Put it down. We're going to make a correction there real quick. Deep breath in, let it all the way out.
Oh, that moved so well. That was huge.
You feel that one, didn't you? Walk around. Walk around for a second. Let's see what it is. I even felt that thing go. Inherently, those are difficult to feel for me because I'm doing a long traction on them.
Yeah.
So you end up feeling them up close sometimes. Some people can, some can't. But that was a release. I like that. Made you laugh, dude, didn't it? Hold that for me. Yeah, it's a little better. How's that hip feeling now? Was it still pulling?
No, that felt good that time.
Good.
I could feel it right away.
Yeah,
right there.
As soon as you engage the muscle. Okay, I think we've got you pretty well balanced. And we'll talk some more about these knees and further taping patterns
Okay.
as we go along in visits.
All right.
Okay,
Sounds
perfect. Thanks.
good. Thank you.